some questions that my patients normally ask, and I thought maybe going over that may be helpful. The first one is what are the complications that are related to the hernia surgery? So overall, the major complications are infection, bleeding, and seroma. Infection risk is very, very low on the hernia surgery, especially when it's done as an elective fashion, not as an emergency. The risk is below 0.5%, very low possibilities. Bleeding is also extremely low. People who are on a blood thinner, we have a different sort of a routine as how they can resume their blood thinner after the surgery, but in normal situations, bleeding after the surgery is very low. Seroma means developing a fluid collection around the hernia surgery region, whether underneath the incision or the site of a hernia repair. And that fluid usually happens with the after the surgery due to reaction of the body to the mesh or even the actual operation. And depending on the type of surgery, it could be small or large. And if that happens, which is usually around 1 to 2% possibility of a seroma, majority of times with abdominal binder, it spontaneously go away, or sometimes we need to drain them in the office. Change in the skin sensation can happen because obviously we cut through the skin, so you're cutting some of the tiny little nerves, so people can get numbness or called hyperesthesia or sensitivity of the skin, and majority of times that go away and is not permanent. The other complications are blood clots. We talked about not laying down all day after the surgery and making sure that you're moving around to decrease the possibility of a blood clot. But any type of surgery can put you on a higher risk of developing blood clots, and those clots can travel to your lung and develop a pulmonary emboli, which is very, very significant. Those are extremely rare to happen. Cardiopulmonary complications after the surgery, like heart attack, a stroke, or developing lung disease, or for example, pneumonia after the operation, which is the infection of the lung, those are extremely rare. We usually don't see that after elective hernia surgery unless patients is extremely old, and we do these type of operations as an emergency for complications related to the hernia. Intra-abdominal complications like damage to the nerves, blood vessels, intestine are extremely rare to happen in this operation. And also other things that can happen in a chronic situations, meaning long-term following up of the patient. Some of the patients, they develop chronic pain, very rare to happen, especially when we do operate with the minimally invasive surgery, laparoscopic and robotic, and we place the mesh away from the nerves. Would decrease the possibility of a chronic pain. The chronic pain is extremely rare, and if it happens, usually we have other modality to manage that. Some of the patients who have extremely large hernia, after we reduce the hernia and we close the defect, sometimes they still develop a little bulge. That bulge, which is the scar tissue, is a remnant of the space that created by the hernia. And it's not a true hernia anymore, but I usually go over that with people who come to my office with a very large hernia that they might experience having this persistent bulge after the surgery. Again, these are scar tissue from the remnants of the space that created from the hernia when it's very large. And majority of the hernias that they are smaller, they don't experience having any bulge after the surgery. Recurrence of the hernia means a hernia coming back is always a possibility. Depending again the type of hernia and the location, this recurrence can be from 0.5% under my hands when I do groin hernia surgery, or it can be up to 5 to 10% in the midline abdominal wall hernia surgery when the hernia is very large and the patient doesn't want to have a mesh, or when we don't use a mesh. So those risks will be discussed with the patient during the initial consultation.